Good evening. Between snowstorms in New Jersey, I'd like to take the time to discuss the effect that malpractice litigation has on the practice of medicine and on the healthcare system in New Jersey, particularly with respect to primary care. Good, robust primary care is the foundation of medical practice, and good medical practice is the foundation of the healthcare system. Uh, Primary care physicians are more vulnerable to litigation than are specialists for the following reason. A specialist is schooled and credentialed in the specialty. That means that he's taken tests. He's spent years restricted to practice of this to training in that specialty, and when he finishes training and takes board examinations, there's an accreditation that he's particularly knowledgeable in that particular specialty. A primary care physician trying to do a procedural stuff in his office, which encroaches on the specialties, has no such protection. That primary care physician, if he tries to sew up a laceration and there's a subsequent infection, is very vulnerable because he cannot answer the question that a lawyer might pose: "Doctor, when did you receive your board certification in surgery?" So he'd have to say he never had a board certification in surgery. If he took wax out of someone's ears and some untoward effect occurred, or 2 days later the patient had a minor stroke, again, "Doctor, when did you receive your board certification in ear, nose, and throat?" And it goes all the way down the line. So the doctor is paralyzed. He has no certification in any of the subspecialties of medicine to practice in his office. There is only one way that primary care can develop the same uniformity of practice throughout the entire nation that specialties can, and that's if the primary care doctor is employed, because the employer can say, "Doctor, here's your job description," whereas the job description of specialties is achieved through training and the board certification test. That specifies what the specialist can do. The orthopedist doesn't take out kidneys; he treats bones and heals fractures. And the urologist doesn't take out lungs. But the primary care doctor, who ventures into office practice, that, for example, he takes a cardiogram. He's now entering into the field of cardiologist. He takes a pap smear or does an internal examination. Now he's become a gynecologist. He has no such protection, and there's no way of developing a kind of uniform practice of primary care throughout the country, because the boards, the certification of family doctors, really would have a great difficulty in determining how much of a specialization this doctor had, because he's only venturing into doing minor work in major specialties. So as a result, the doctor is, from the point of view of litigation, very, very vulnerable. And as a result, primary care doctors do little more than write prescriptions and refer patients out. Referring patients out is extremely expensive and costs, by my judgment, between $100 and $200 billion a year to the healthcare system. The only way that primary care can be regularized would be if the primary care physician is employed, and the only employer large enough to regularize primary care specialty so that procedures could be done in a robust way would be the federal government, and the federal government can do this through Primary Care Centers of America. So thank you very much for your time, and we'll meet again to discuss this further.